So mild atopic dermatitis doesn't have a lot. I mean, they're very itchy, but not very scarred. Not a lot of plaques. You start going, what are you doing treatment-wise? Fragrance is the first thing that I take out of people's lives, and not just with the lotion and not with just soaps, but even detergent, fabric softeners, dryer sheets. I've had people go, I use all clear, and I go, that's nice, but do you use dryer sheets? And they go, of course. I want it to smell good. Defeating the purpose. You have to change everything. I'm not that person that doctor says you can't take a bath or a shower every day. Just to be conscientious of how you do it. Don't take a hour-long hot shower. Decrease the time, decrease the temperature, and use different products. Like I said, I like La Roche. I like Cetaphil Restore, moisture restoring wash. All those washes are great. They're not just the hypoallergenic washes that don't lather. So they do lather, but they don't have scents, and they do hydrate the skin. After that, you do want to lotion up. A lot of people tell me I don't want to feel sticky all day. Then do something that's lighter. There are lighter versions of those lotions as well. La Roche has a triple repair one. The Cetaphil lotions are also not as thick as like the traditional Nivea or Lubriderm washes. Vaseline has an intensive care one that isn't as heavy. So there's different ways that you can approach it. I do believe in giving a cortisone at first, though, even if it's mild to moderate, because you have a child that's scratching or an adult that's scratching, you don't want to lead to infections as well. So you try to spare from a cortisone. That's a misconception that if I give a cortisone, it's going to thin out. How long does it take before your skin thins out? We're not delicate little dolls. We can do it for a certain amount of time, and you just teach your patient. 2 to 3 weeks, twice a day, medium, moderate level corticosteroid.
What is that percent?
So triamcinolone is a really great moderate one. So is desoxymethasone or Topicort. Those are great, and they moisturize the skin. At that same time, you're trying to think, how do I get them off of this cortisone and to maintain without a corticosteroid? Because long-term exposure can thin out the skin and atrophy the skin. But you're following up with your patient, you're educating them that don't do it that long, and introduce a non-cortisone cream. And a great example is your Eucrisa. Those are the phosphodiesterase 4 inhibitors. And they're the newer forms of the topicals that are non-corticosteroids, so non-atrophying of the skin. And they can stay on those, and studies have shown that they can stay up to for over a year to reverse the effects of atopic derm. So let's get them out of that chain. And of course, antihistamines. You want to stop itching as much as possible. I like Zyrtec, I like Claritin. But I mean, you want to be able to do that mildly.